Today, I want to highlight the aggressive actions we have taken since the start of the pandemic to protect residents and staff of nursing homes. Safety in nursing homes during this pandemic has been a top priority and a key component of our response strategy since day one. We have worked to support, guide, and hold accountable nursing homes in their commitment to protect residents and staff during COVID-19. I want to acknowledge the dedication and care with which so many facility administrators, clinicians, and staff have approached this work. And I especially want to salute the frontline staff and clinicians who are caring for these residents throughout these challenging times. As we go through this important topic, we have some slides, and yes, we have a few graphs to guide our update. So our nursing home residents are amongst the most vulnerable to COVID-19 infection for a number of reasons. Many are elderly and many are medically frail with multiple chronic medical conditions, putting them at higher risk for severe COVID-19 illness and worse outcomes. We also know that the virus spreads most efficiently when people live in group settings and are gathered together in one place. The communal nature of nursing home facilities can make it difficult to control a COVID-19 outbreak. The safety of these facilities has been a top focus, as I said, from the very beginning of this pandemic. We knew that this would be hard and complicated work. After consultation with facilities and staff, scientific and medical experts, we developed and have been deploying a 5-point strategy to guide that work: prevention, staffing, testing, outbreak management, and oversight. We're seeing evidence that our strategy and hard work across these 5 areas is helping on a number of fronts, particularly in infection control. We are making progress. The quick, effective actions we have been taking on this front have had an impact. Now, fewer nursing home residents are becoming sick when there is an outbreak, and outbreaks are being resolved faster. All good news. As we move on to some graphs, this one shows that the number of people who are impacted by an individual outbreak at a facility. The bars show the number of people who have COVID at any one nursing home outbreak. And we want to see those numbers be as low as possible. And you can see in this graph that there are fewer nursing home residents getting sick when there is an outbreak. The yellow line shows that downward trend, and that is a good thing. On this next graph, we also see progress when we look at the length of time these outbreaks are lasting in nursing home before being brought under control. You can see, looking at that yellow line, the percent of outbreaks lasting longer than 6 weeks has fallen significantly, and that's progress that needs to continue. Now, this slide shows how we in North Carolina compare to other states in terms of cases in nursing homes. You can see that we have fewer cases than many states, but there is still more work to do. As we move into the next slides, I'll talk about some of the highlights of what that work looks like. Back to our 5-point strategy. Prevention is a central element of our response. We want to do everything possible to keep COVID out of nursing homes to avoid having outbreaks in the first place. We know that COVID-19 can be brought into nursing homes by staff and visitors, delivery people, and other outsiders, which is why limiting the number of people going into a nursing home was a key priority early on. For the staff who care for residents each day, the state has sent personal protective equipment like masks, gowns, and gloves, and face shields to every nursing home in the state. We've also required staff to wear masks, increased prevention training for staff and administrators, and limited group activities to minimize transmission in a congregate setting. We have also been helping facilities to make sure they have the workforce they need to care for their residents and respond to any outbreaks. Our team has helped fill staffing shortages, making thousands of employee referrals and offering reciprocity for out-of-state nursing aides. We are supporting facilities with funding to keep and train staff. Once again, I want to emphasize and applaud the work so many dedicated nursing home staff are doing across North Carolina under exceptionally challenging circumstances. In July and early August, we have been conducting baseline testing of more than 49,000 residents and staff in North Carolina's nursing home. Existing guidance requires nursing home staff to be tested weekly if a COVID-19 case has already been detected in their facility. And previously, our guidance also recommended staff testing every 2 weeks. Today, we are announcing that we are turning that recommendation into a requirement for testing of staff every 2 weeks. And we are giving nursing homes financial support to make that testing happen. And I'll come back to this in a moment. When an outbreak occurs in a nursing home, time is of the essence. We require facilities to report any COVID-19 case promptly to their local health department. From that moment, in coordination with the local health department and the facility, we are providing direct technical assistance to contain and control the outbreak and protect other residents and staff from being infected. We also recognize how important it is to make sure that guidelines are being reflected in everyday practice and to make sure our nursing homes are complying with all of the rules and best practices. That's why oversight has been key, and in a fast-moving pandemic, we have approached oversight with urgency. I'm pleased to say that we've already completed on-site infection control inspections at all of the nursing homes in North Carolina. And those on-site inspections were completed 1 month ahead of schedule. We have also been providing timely infection control inspections of every nursing home that has had its first case. So together, these 5 elements of our strategy, prevention, staffing, testing, outbreak management, and oversight, have allowed us to build a solid framework for ongoing and future work. As I mentioned earlier, today I have issued an order mandating testing every 2 weeks for all nursing home staff. The clinical team members who care for our nursing home residents live in our communities, where there is community spread of this virus. And as we have come to understand, a person can have the virus and not know it. Thus, testing all staff proactively every 2 weeks allows us to identify asymptomatic cases early and prevent spread to residents who are at high risk. To help facilities comply with this new requirement, we will leverage federal CARES Act funding to pay for testing every 2 weeks through the month of November. Another step we're taking today is to build on the progress we've made with our 5-point strategy, and it's also to add 10 regional infection control support teams to help nursing homes and other long-term care facilities prevent COVID-19 transmission and manage outbreaks that do occur. These teams will provide on-site infection prevention and control help, continuing our work with nursing homes to implement protocols and minimize the length and severity of outbreaks that do occur. As I conclude this update, I want to highlight that every COVID-19 infection that reaches a nursing home started somewhere else. And that's why everyone in North Carolina can play an important role in protecting people in nursing homes. Slowing the spread of COVID-19 in our communities means that those who work in nursing home settings are less likely to be exposed to the virus and thus less likely to bring it back to a nursing home where they work. You can help slow the spread of COVID-19 to our nursing homes by practicing the 3 W's. Wearing a face covering over your nose and mouth, waiting 6 feet apart, and washing your hands often. Wear, wait, and wash.